All right, folks, you're back again with us. And right now, we're going to talk about something that is probably on the negative side. We're going to talk about colon cancer, which is a disease that has been escalating over the years. And recently, there has been a surprising increase in cases among young adults.
That's the most surprising thing. So I actually had a family case, and luckily, my family member made it through alive, and she's still doing very, very well. So it doesn't always have to be a negative, but it's always good to be educated. And this disease has become a significant problem that we do need to be aware of on these days because, as Archie's mentioned before, more and more young people are being diagnosed now.
Yes, that's true. And regarding the awareness, we need to understand the causes of colon cancer in young adults, how to treat it, and how to prevent it. And joining us with us today is internist and gastroenterologist Professor Fahrial Syam. Professor or doctor, should I call you? Thank you for joining us.
Thank you.
Thank you.
Thank
for
you.
coming. Good morning.
Yes, good morning. So, Doc, we've heard about this, that the cases of colon cancer in youths are increasing. So, what could be the factors that contributes to this?
Yeah, so first of all, I would like to say that the colon cancer is one of preventable cancer. So I think we can prevent with this disease. This is the important things. Why? Because you know that if we talk about the colon cancer, there is what we call the risk factors. Risk factors. Actually, we have risk factors that we can change this risk factor, like genetic, okay, and about age, elderly, we can change that. But for other risk factors, we can change these risk factors. For example, stop smoking. Okay, we know we have problems with the smoking now here in Indonesia as well.
Yes.
Because you know that one of 3 adults in Indonesia is smoking. This is a really, really big problem. And also they start smoking in the early age. Sometime maybe in the elementary school, we can see in television or social media about that.
That's right.
And also about the alcohol consumption. This is our problem as well. And about the diet, you know, most of us like to take what we call that red meat diet. See, you can see everywhere that they love red meat diet, like lamb, okay, and cow or something like that. And the other thing, they don't like to eat vegetables. They don't like eat fruits. This is our problems as well. So again, as I said that actually the colon cancer, we can prevent this disease.
Right.
And then, okay, if you want to, take with this cancer, so you must to do the good lifestyle that I mentioned.
But how about other things like gluten, for instance, and high processed foods? Doesn't that also include to the risk factors that we're eating? Junk food, for instance?
Yes, processed meat, something like that. This is one of the risk factors as well. Yeah.
Processed meat.
Processed meat.
Processed
you know,
meat,
like
so, like corned beef,
corned beef,
sausages.
Sausages, that's right. That's right.
Okay.
Right.
Yeah, you can say that, okay, if there is 2 options for our kid, this is a chicken, and then this is sausage. So maybe they will take a sausage, right?
Yes.
This is one of our problems now.
That's
And
true.
sometimes that their parents love to know that because, you know, sausage is the easy one.
Easy one, yeah,
Like
yeah.
to
Easier,
see-
that's true.
To, you know, for the chicken one.
So it's the dangers lie in the processed things,
Yes.
right? Okay.
Yes.
So can you explain how colon cancer affects young adults these days? Because we've just heard that there is a staggering statistics that say that the patients have become much and much more younger and also a lot more prevalence. How does that happen? Is that strictly the lifestyle or
Yes.
is that what else?
Yeah. You know, I think this is my about 24 years as a internal medicine doctors to do endoscopy. Maybe 20 years ago, if we found cases with the colon cancer, most of them above 60 years. But now I can see that our patient above 30 years. So this is our problems now, that the affect to young people. What, because yes, I mentioned that about the the risk factors about the lifestyle.
Yeah.
See, so that's why I think we must give examples to our children how that their mom, their father also eat vegetables. And then we try to give the vegetables to our children. This is the simple things, how they can prevent cancer in the future.
Yeah.
Yeah.
So giving examples.
And also, in activity. Before, when I was younger, as a kid, we have, play football, basket, or everything. But now, they just sit and then just see the game online, maybe something like that.
Right.
So this is our problems. What we call that the inactivity or sedentary. This is our problem. So that's why we must change this if we don't want your family get the cancer in the future.
But there's been cases where very fit people or like people with a very proven healthy lifestyle, like athletes, being diagnosed with cancer. Is stress, could also that be a factor? Because I feel like kids these days live under a very different stress level than we did back in those days,
That's
or the previous generations.
That's right. Yeah. So this is the important things that stress is correlated with the cancer as well.
Yeah.
I mean, if you are in the condition of stress, maybe there will be increased cancer. If you have maybe what we call that your family, the genetic or other things. And sometimes they're active, very exercise, but we just want to know what kind of food they take. Maybe they love red meat, and then they don't eat vegetable, for example. Yeah, so that's why we must to look for why they are active but still get the cancer. And also maybe correlated with the family history. Maybe.
Genetics as
So
well.
there's also genetics and hereditary cancer.
That's right.
Playing the role. Right, Doc. So I want to ask you, is there any difference between colon cancer that is, or when young adults get it, or when older adults get it?
Yeah, actually, colon cancer is colon cancer. There's no difference. Maybe patient come with the, GI bleeding, for example, or maybe patient come with the abdominal pain. There's no difference. The symptoms between a young adult colon cancer with the old colon cancer. So, yeah,
so it's the same.
The same.
Right,
The
and the
symptoms
treatments are also the same.
Also the same.
The prevention.
treatment,
is also the
if
same.
if there's like something like that, the stage 3 condition, there's a tumor obstruct in the large bowel, so that the doctors can perform the surgical resection, and then after that, maybe this patient need chemotherapy or something like that.
You've mentioned a lot of vegetables. How does vegetables specifically help in terms of preventing colon cancer?
Yeah, see that it does any kind of vegetables.
Or fruits.
Green, for example. Yeah, so you must, we must give it to our children. Yeah, any vegetables. And the important things, besides vegetables, you must take fruit as well.
Yeah.
Because, there is a different contain of antioxidant or something like that. And also maybe the fibers. Yeah. So that's why, please, sometimes the patient, okay, I take vegetables, but I don't like fruit. No, you must take both of them.
Right.
Because, to make your fiber or your antioxidant complete.
Right. So, Doc, what is actually, I'm curious about, if you look at your lunch or your dinner, like what is the ideal proportions of each?
Interesting.
Yes, carbohydrates, protein, what do you have? Vegetables. Yes.
And fruits for, fruits.
Yeah, and also
before
the fruits.
or after?
Yes. Yes.
Yeah, okay. So, first of all, we must know that what we call it, how much the calorie, the calorie first. For example, if you have 50 kilograms, so we can take around 1,500 calorie. Okay, from this calorie, maybe around 40% from carbohydrate. Okay, and then maybe 30% from fat or something like that. So yes, so must care about how much calorie they'll if you want to take. Okay, there is maybe for the carbohydrate, maybe from the rice, for example, or potatoes, doesn't matter. And about the fat, so you must be careful about the fat, and also the protein. So we advise that please take protein from fish. This is the important thing. Yes,
fish.
Yes, fish
Right.
is a good thing.
It's a
Also for your
good
gut
source,
as
yeah.
well. For example, because you know that if you take more fish, so they will push your acid production. This
Oh,
is the
stop
important
pushing
thing.
down.
Yeah,
the acid.
stop.
Yeah,
Yes,
yeah,
pushing your acid production.
Okay.
But if you take a lot of red meat, they will increase your acid productions. So this is one
Interesting.
of that. Why we need more fish than red meat.
Yes.
Okay, and then about the fruit to mention. If you want to take more calorie, please take fruit before your meal. This is important because stomach like like a pump. So
Yeah.
if you more fruit before, so that's you don't want to take more
More
rice
food,
or other
yeah.
because it's so many full from fruit or something.
So it's actually better to take fruit before you eat.
Yeah, it is. Yeah, I mean, what is your target? If your target is to reduce body weight, please.
Which
do
is
that.
everyone's target
Yeah.
these days, right? now.
Well, what are the risks of, how, maybe let's talk about innovation. What are some advancements that have been made in the treatment of colon cancer?
Yeah, so I mentioned that if patient, one thing that the important things is what we call that early detection,
Okay.
screening. So if you find patient, the condition just only polyps, so we can just cutting the polyps, the easy one, and then we stop that the polyp to be a cancer. Okay, so the problem is we find this patient with the end stage, for example, with the big tumors. So in these conditions, we must take what we call a surgical resection, and after that, chemotherapy. Yeah.
Right.
But sometimes, if with the condition of the advance of cancer, sometimes we make colostomy. See?
Yeah.
This is a bad things, but I always support. Don't worry because you are not alone. Many people with the colonoscopy and still alive until now. So this is one of tricks that I explain to patients that if they need to have a colostomy.
Okay, it's really interesting because I really find that what are the symptoms? Like I think when it comes to screening, it's also most important for us to know ourselves. Could you talk about some common symptoms that people need to really be aware of that it could be a sign of colon cancer?
Yes. Yeah. So I mentioned that before about the what we call it the bowel changing. Bowel movement changing.
Okay.
Like constipation and sometimes diarrhea. So this is, this is one of things that why we bowel movement different before, yeah? Because before maybe they had normal bowel movement, but now they have a problems with the what we call the defecation or constipation. Problem with defecation, constipation, or diarrhea or something like that. And the other things about the what we call that the lower GI bleeding. Lower GI. Sometimes patient that I have something wrong with my feces this morning, so with maybe lower GI bleeding. But sometimes they only just maybe it's only hemorrhoid. So please don't to be a doctor for your body. Sometimes they just hemorrhoid. So they don't care about that.
Right.
No, you must go to a doctor
Yes,
to make
see a
sure
professional.
it is only
Hemorrhoid.
or something else. This is the
Right.
important thing. And the third things about the loss of body weight. See, loss body weight, what we call that, the unexplained of loss of body weight. If you lose body weight because you are, about the diet or more sport or more exercise, it's no problems. What we call the unexplained of loss of body weight. And also unexplained of anemia. Yes. Okay, and chronic abdominal pain. Pain.
Right.
Maybe sometimes patient just maybe from gastritis or maybe from your dyspepsia or your stomach. No, you must go to a doctor's to know what is the cause of abdominal pain for you, or something like that. Yes, this is the symptoms, and sometimes a patient, what we call that the severe constipation. For example, they done defecation since 7 days ago, something like that.
So we also have to keep track, right?
Yes, that's right.
Right.
Well, Doc, thank you so much, Doc Ari, for
You're
coming.
welcome.
And this is certainly a very, very interesting conversation. So less processed foods and eat your veggies, apparently, and fruits, right?
Yes. Take less red meat.
Well, I'll certainly try. Let's take a break, but after a break, we have more updates just for you. Stay tuned.